Hi, I'm Dr. Michael Walsh. Today we're going to be talking about epidural steroid injections. As a practicing neurosurgeon, I don't perform these particular procedures, but I do have a lot of patients asking me about them, and I will often refer patients for them, so I thought it would be a good topic of conversation. So when somebody has pain related to a spinal condition, the way I often explain it to patients is that there's frequently one or both of two components. There's mechanical compression, where there's actual squeezing, so to speak, of the spinal cord and the nerve roots, and that can obviously cause pain along with a lot of other problems. But then there's also a component of inflammation. A lot of times those two components are wrapped very closely together, so you can actually have mechanical compression with secondary inflammation. It's important to remember that an epidural steroid injection is not necessarily going to relieve mechanical compression, but it can often help with inflammation. This is helpful for a couple of different reasons. I put it in terms of having both a diagnostic role, but also a potentially therapeutic role. Now, when I say it's a diagnostic role, what I mean is that when somebody has a steroid injection, sometimes it can give us a good idea about where the inflammation is, which can give us a hint as to future treatments if the steroid injection ends up not doing everything that we hoped it would, or if it ends up wearing off. From a therapeutic standpoint, it means that it can actually treat some of that pain and sometimes avoid larger procedures down the road. The steroid injection involves putting a needle in or around the spinal column where we think some of that inflammation is coming from. A strong anti-inflammatory medication is then injected. Since I don't perform these procedures, I usually defer to the physicians performing the procedures to have a more extensive discussion about risks and benefits and how frequently one can have those injections. I hope you've enjoyed this video. If so, please leave a like and consider subscribing to this channel. I'd also love any comments about things we can do better or other topics you'd like to see discussed in the future. As always, I'm Dr. Michael Walsh. Until next time.